Hi there, it's Dr. Carmen Doerr-Nauth with Aware Chiropractic, and today I just wanted to take a little bit of time out and give you some more information on the Webster Technique and how we utilize it in our office. So a huge part of our mission is serving the pregnant women in our community, and we want to make sure that you and your family are fully aware and understand what to expect when you come into our office for the Webster Technique. So why would I want to see a chiropractor if I'm expecting? So we do see a lot of pregnant women in our office with things like hip pain, low back pain, pubic bone pain or groin pain, round ligament pain, and even sometimes sciatica. And while we can absolutely help mom with that, there's also additional benefits to the Webster Technique and chiropractic during pregnancy in general. And some of those are that it can decrease labor times by up to 50%. I mean, who wouldn't want that, right? And then also, we want mom to be encouraged and have a loving environment so that she can have the enjoyable pregnancy that she so deserves. Because growing a life is such a huge accomplishment that it should be celebrated. So now that we know what the Webster Technique is, I want to clarify what it's not. So it's gained a huge following and has been termed a breech turning technique or a baby turning technique, and I want to clarify that that absolutely is not the case. The technique actually adjusts mom's pelvis. It doesn't do anything to baby. Actually, doing anything to baby is a practice of obstetrics and is not within the scope of practice of a chiropractor. So we take care of mom's pelvis, and in turn, mom's body can do what mom's body needs to do, and then baby's body in turn can do what baby is supposed to do. So enough of me talking, let's go ahead and see what a Webster adjustment looks like in action. So the first part of the adjustment, we're going to be checking mom's sacrum to make sure that it's aligned correctly. And here you can see that we're checking to find out which side we need to adjust on. And then to correct it, we're using a very, very light drop. And then we're rechecking to make sure that we've cleared that subluxation, and then we can move on to the next part of the technique. All right, so right here, we're checking the sacrotuberous ligaments, which run from the sacrum to the ischial tuberosity on the hip. We're checking to see which side is tighter, and then we're doing a hold to release that ligament. All right, so the next step, we're checking the piriformis muscle. A lot of times when women are experiencing sciatica, this muscle is absolutely involved and is tight. So we're checking here, and then we're doing a piriformis sweep, basically releasing that muscle and allowing it to relax. And then lastly, before mom turns over, we're gonna check her pubic bone. So I'm gonna have her squeeze her knees against my fist and then check her feet. And then we have mom flip over onto her back, and we're gonna go ahead and adjust that pubic bone with, again, a very, very light drop. And then we're rechecking to make sure that that's cleared. And then next, we're checking the round ligaments. A lot of times as pregnancy progresses and baby starts growing, these ligaments get stretched and can become very painful. So here we're just finding which side is tighter, and then we're doing a contact hold to release that and allow it to relax. All right, so here we're checking mom's arms to see which is shorter, which indicates which side of the psoas muscle is tight and which one we need to release. So you'll see here that we're releasing that muscle, and then of course we're gonna recheck and make sure that we've cleared that. And as you can see here, we needed to do a little bit more, so we went back and released it for a little bit longer, and then we rechecked again, and here it cleared. So mom is all set to go, and her pelvic biomechanics are restored. So now that we've learned a little bit more about the Webster Technique and we've seen it in action, we have a couple of takeaways for you. So first, it's best to start as early as possible so that we can hopefully prevent you from having any of those symptoms that we talked about earlier. Second is to make sure whichever chiropractor you choose is Webster certified. You can actually find a Webster certified chiropractor right here on the ICPA website, or you can give our office a call and we're more than happy to serve you and your family. We're serving the Katy and West Houston communities, and we look forward to seeing you soon. Have a great day.